Posterior Cervical Fusion. Introduction. Can you point to the vertebrae? Choose one of the following options. Correct. Can you point to the discs? Choose one of the following options. Correct. The most common cause of unstable spine in the neck is a cervical fracture. Select true or false. Correct. A cervical fracture is the most common cause of an unstable spine. The devices implanted in the spine help hold the fusion together and help restore the normal shape of the spine. Select true or false. Correct. The implanted instruments have two roles. They help hold the vertebrae together until the bone fusion is complete, and they also help to restore the normal shape of the spine. All screws used to fuse the bones are fully FDA approved. Select true or false. Correct. Some screws are not FDA approved. However, they are recommended by a majority of spine specialists. Are heart attacks and other anesthesia-related complications common during and after spine operations? Select yes or no. Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Are infections very common after spine surgery? Select yes or no. Correct. Infections are very rare. Though rare, infections, bleeding, and scarring may occur. Paralysis and weakness are very common after spine surgery. Select true or false. Correct. Paralysis and weakness are very rare in spine surgery. Although these risks are rare, they can still happen. A medical device may crack and fail, perhaps requiring another operation. Select true or false. Correct. A device may fail, but this is unusual. It is impossible to injure the blood vessels in this surgery. Select true or false. Correct. It is very unlikely, but not impossible, for the blood vessels to be injured in this surgery. The operation is always successful. Select true or false. Correct. The operation tends to be successful. However, it may fail in helping the symptoms. There is also a small chance that the symptoms may become worse than before the operation. Thank you for using Explain.